Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Robert Yoho. He's a cosmetic surgeon and is the author of the book, Butchered by Healthcare: What to Do About Doctors, Big Pharma, Corrupt Government Ruining Your Health and Medical Care. And he submitted an excerpt of that book to Kevin MD titled How I Was Wrong About Healthcare. Robert, welcome to the show.
Thank you, Kevin.
So we'll get into your article and book in a little bit, but first off, can you briefly share your story and your journey to where you are today?
Sure. I spent the last 35 years in cosmetic surgery doing liposuction, facelifts, breast augmentation, and that sort of thing. And I'm sort of like Rip Van Winkle. I haven't studied general medicine for decades. I was lost in this rabbit hole. And what happened to me was I had 2 fatalities in my surgical center within 4 months. And it was, as you might imagine, it was just a horrifying experience. You can read about that in my book. But it sort of woke me up to the idea that my career was nearing an end, and I started to read about general medicine and healthcare, and I got into medical corruption for some reason. And I started with the SSRI antidepressants, which I had prescribed for most of my career, and I found out that they were largely ineffective. And I went on to study the rest of healthcare over 3 full years of working nearly half time on this book. I sort of woke up and I had a perspective that was almost outside of healthcare because of what I was doing. It was so specialized.
All right, so let's jump into your article and book because there is a lot wrong with our healthcare system, and I'm interested in hearing your take on it. So, again, your book is titled Butchered by Healthcare: What to Do About Doctors, Big Pharma, Corrupt Government Ruining Your Health and Medical Care. And the excerpt is titled How I Was Wrong About Healthcare. Now, Robert, for those who didn't read that excerpt, can you just walk my audience through it and maybe share the story of why you decided to share it with the Kevin MD audience?
It essentially is a list that introduces the major topics of my book. And if you look at the big problems in healthcare in order, it probably is number one, the insurance companies, which skim about 25% of the nearly 3 trillion that we spend on healthcare right off the top. And it's something that doesn't happen for the most part in other countries. And their administration actually produces deleterious effects. They're not motivated to conserve costs because they get their money off the top. Number two is hospitals, and they are over a third of our total expenditures. And again, they're sort of capitalist organizations that are not designed to deliver good healthcare. They're designed to deliver money. And most of those are actually nonprofits. And the nonprofits are an illness in our society because there's no oversight. There's no board oversight. They can do whatever they want. And what they do is they just expense any profits. And their profits are phenomenal, but they spend them buying up medical practices and so on and so forth. Another important precept is how much the money influences professionals and how and what do we do about conflicts of interest. And most people think that you can, at least the industry trope is that you can abolish conflict of interest by revealing it. Well, we have a large studies literature about influence, and influence due to money is profound, pervasive, and unavoidable. And anytime money changes hands, basically the well is poisoned. So in medicine, we have this shower of money coming from the very top in forms of these third-party payments, which are, and then we combine that with a sort of a capitalist system that is fee for service largely, or profitable activity for the hospitals. And it basically poisons the whole thing. What happens is the large organizations come back and they bribe off our Congress, they bribe the physicians, they bribe the standards people. And, I don't use that term lightly. Bribe is a legal term, but it should be thought of as bribes. And I believe that prosecution is the only way to get around this stuff. But the problem is we're already bought. The money is already spent. The doctors, nobody recognizes that these conflict of interest create pervasive problems.
So let's talk about the first thing on your list. You mentioned third-party payers and insurance companies, and I don't think it's disputed that the administrative cost in the United States healthcare system is exorbitant compared to the rest of the world. Some of the counter arguments is that the insurance companies, they're so entrenched in our healthcare system, it's very difficult to divorce ourselves from that. So what is your solution to divorce ourselves and maybe take a step away from those third-party payers, especially when they're already so entrenched?
It's a little bit of discouraging story. In the end, the solution for the patient is to understand what's going on. And really, the first step for everyone is to understand what's going on. And I think you can get a pretty good feel for it by reading my book. The physicians who have read my book are not aware of the whole story and have a revelation. But for patients, if you understand the limits of healthcare, if you understand that the doctors really can't save you from death or mortality, if you understand that science is limited, you can sort of start to develop a philosophy of your own, which I get into in the last chapters, that will help you. But as far as the global picture goes, I think if everyone starts to realize how corrupt the entire thing is, that maybe there's a prayer of changing something. And I think ultimately, this stuff has got to be prosecuted. The people that have tried to prosecute healthcare companies have had a very difficult time. That we've thrown 20% of our gross domestic product at healthcare, and in return, we get these mobsters move in. And I don't use that word lightly. That's not my word. It's Peter Rosk's word, who is describing the companies that he worked for. He says they behave like mobsters. In return, we get these mobsters move in who don't have our physician ideals.
Mm-hmm.
And physicians still have ideals. I mean, we're trying as hard as we can in a system that where we're spending 50% of our time screwing around with medical records, because of statutory requirements. Where the thing got the most out of hand was a 2003 law where Bush signed this thing into law that said that we can't negotiate with Medicare any longer. We had to pay 107% of the wholesale of their, and that sounds reasonable. But what happened is they're allowed to price fix, and now we're something like 4.5% of the world's population. We pay 40% of the drug costs in the world. I mean, it's a crazy, crazy deal. Even the VA negotiates with pharma for their costs.
In your vision, what's the role of government in terms of regulating both the pharmaceutical industry and even regulating the insurance industry?
There's no easy solution, and I don't think a single payer is the way to go. I think that we've seen now Medicare does protect the patient better than any other solution that we have currently. Part of the problem is that these entities that we're dealing with, the hospitals and the doctors, they compete for the third-party payment dollar with the insurance company. So everybody submits competing bills,
Mm-hmm.
and they're just incredibly outrageous. I mean, my wife has a problem, and she went and paid cash. She's Medicare. She paid cash at a California institution for 2 chemotherapy treatments, 2 doctor visits, and a bone marrow. Guess what the price was? The retail price, $266,000.
Okay.
I'm not kidding. It was not a hospital stay. So that was bargained down to $40,000, which is still insane. But anyway, they're just out of control. Now, fee for service has got to go. Now, I did fee for service my whole career, and I thought it was ethical. But even as little insight as you have to your own behavior, I'm sure that I did things that were not 100% in the patient's best interest. Kaiser has a pretty good system. It's imperfect, but they have internal controls. They have the freedom to practice without fear of reimbursement problems, or they don't have to pay their office staff. And I think giving the money to entities like Kaiser, who can compete against each other, is a reasonable first step. And that's the best thing I discovered. I don't think that anything like what we're doing now, like Medicare for all, it's still fee for service. Kaiser integrates the 3 entities, right? The hospital, the doctor group, and the insurance company. So those 3 things don't compete against each other in theory. And in theory, they're not like they're growing like a weed too. The healthcare is so well funded that these guys are getting double digits growth rate every single year. They're building new facilities and everything else. And this is crazy because we've got way too much healthcare right now. Everybody says, oh, we need healthcare. The things are shut down during the pandemic. So, people are dying because they can't. This isn't true. We are delivering twice the healthcare that other countries are.
Mm-hmm.
It's costing us roughly, it's not 20% yet, but it's close to 20% of our GDP. All the other first world countries, around 10%. Singapore gets by for 5%. And their numbers are better than ours. Their overall mortality, we're like 40th in the mortality in the timeline. So I think our healthcare is ruining our lives, and we don't need more healthcare. So if we were able to get a system like Kaiser in place not for the whole thing, because central administration will screw it up, is if we get these entities and they compete against each other, where they don't have to, where the insurance company doesn't have a separate set of stockholders and other idiots that they've got to satisfy. They don't have to pay their CEOs $20 million each. Kaiser, the top of the pay scale, I think, is around $3 million or something like that. And he probably deserves it. So if we get these entities like Kaiser competing, it's my opinion that we could squeeze them and get our costs down. So
we're talking to Robert Yoho. He's a cosmetic surgeon, author of Butchered by Healthcare: What to Do About Doctors, Big Pharma, Corrupt Government, Ruining Your Health and Medical Care. Robert, if you were to give us a take-home message and perhaps the next step in terms of fixing the problems you articulate, what's the next step that we should take?
Step is to learn as much as you can. And my take-home message is, as negative as I am about the whole thing, and as many stories that you're going to hear, and that you've just scratched the surface of the corruption of both the doctors and industry here, as negative as I am, I want to emphasize that half of what we do is very, very important. And the other half we don't know about, and a lot of it doesn't work. But half of what we do is important, and I don't want to present the idea that I'm some sort of alternative doctor who believes in nuts and berries and nutrition, and that we can just give up on all of healthcare, because there are miracles that are happening every day. They're too expensive. The system's set up to make them cost hundreds of thousands to even millions of dollars a year for some of these things, but they are tremendous improvements. And my take-home message is that patients and doctors have got to be very skeptical about what's going on.
Robert, thank you so much for sharing your insight, and thanks again for being on the show.
Thanks, Kevin. I really appreciate it.